Today I'd like to define the microbiome, what that means, explain what it does, and discuss how it affects our health, why we think it's so important in the medical field. And then finally we'll talk about ways that you might be able to modify the microbiome in a favorable way that will influence your health. So let's see, what is the microbiome? So this is a collection of bacteria, viruses, fungi, phages, archaea, that all live inside our body, in our gut. There are somewhere between 7 and 100 trillion microbes in our gut. This is more than we have, this is more single-celled organisms than we have human cells in our body. And there's 500 to 1,000 different species that live in our gut. So we really are just a bunch of single-cell organisms that are living in this shell that we call our body. The range between 7 and 100 trillion, the trillions are just a phenomenal number anyway. And the range is there because I don't think anyone really knows how many exactly bacteria we have, and it will differ from person to person. So that's where that range comes in, both for how many creatures live in us and for how many different types of species live there. I did want to make another point, and just to emphasize how important this actually is. When you look at the research going on in medicine, there were 4,000 papers published in 2017 that focus specifically on the microbiome. And there are so much more coming. So it really is something that people are hopping, they're looking at this really closely. So the work of the microbiome, as we understand it, like I said, there's still a lot of research happening, and so we're still trying to figure out what all it does, but we have some basic understanding at this point. So, a pretty picture here. So on the left-hand side of this picture is or a schematic that represents what's happening in our gut when we have good bacteria at work. And so when we have good bacteria, we have a nice thick mucus layer that sits on top of those cells. I'm going to point to where that is. It is on there, and it's in blue, but I don't think you can appreciate it probably from the back of the room. So that is all. That's all the mucus layer that sits on top of those cells, okay? And that mucus layer, just by its physical presence, provides protection for us. Because if you think about what's happening in the gut, we're introducing, everything that goes into our body pretty much is going through our gastrointestinal system. And so we need some layer of protection there to keep out the toxins and the bad things that we don't want. One of the main things the bacteria do for us is they help develop that mucus layer that sits on the inside or the lining of our intestines. Excuse me? Did someone say? Okay. It also, what's really cool, I think, especially in my line of work where I counsel people on how to lose weight, is these bacteria also signal the rest of the body and send out hormones that tell the body when we've eaten enough. And that's pretty cool. So bacteria are putting the brakes on our appetites a little bit too. And when we feed them and they've had enough, they tell us we've had enough too. And then finally, the bacteria communicate with our immune system. So they're sending out signals that's telling the body, are these foreign substances? Are they things we like? Are they things we don't like? And then our immune system responds accordingly. So hopefully that wasn't too much gibberish, but just to sum it up, the microbiome provides a layer of protection in the form of that mucus layer. That keeps unwanted microorganisms or bacteria or viruses out of our body, and anything that those bacteria or viruses also make. That microbiome communicates with our immune system, It plays a role in appetite signaling, and it also determines how much our body will absorb of the food we eat. So we talked about all the different species that can live in our gut, and the species that live within us are influenced by many factors in our life. So initially, when we're born, depending how we're born, we're first inoculated with these bacteria. So if children are born through the normal birth canal, whatever bacteria mom is carrying inoculates the baby. And that's why we talk to women about, good nutrition during their pregnancy, is that she's passing that on to her child in the womb and even on their way out. If children are born via C-section, they have a lot less bacteria living in their gut. So that's our first introduction to the little guys that live inside of us. The second thing, these are my kids. Gratuitous pictures. The first photo is my now 9.5-year-old son, and this is my 7-year-old son. The second thing that can influence our gut is what we eat. He's not eating something that would have a positive influence on his bacteria, because that's taken at Café du Monde, where he's eating a beignet. But what we put in our mouths affects what bacteria grow, because what we choose to eat will feed certain bacteria and may not feed others. Who we live with also impacts what bacteria live in our body. So children who grow up living with pets will have a different collection of bacteria, types of bacteria, than children who maybe don't grow up with pets. Another interesting example is when you look at people who have obesity, their spouse is more likely to develop obesity if they develop obesity, to the tune of about almost 40%. So if your spouse becomes obese, you're 40% likely to also become, or 40% more likely than the average person to also develop obesity. If it's a good friend, it's like 60%. So that tells you who we spend most of our time with in our lives. But part of the reason that researchers believe that is so is because we're transmitting different bacteria between humans, and that again causes different absorption, different appetite signaling that can lead us down the road of gaining more weight. Other things that can affect our microbiome are food additives. So that's a big one, because there's a lot of additives in the food we eat. And I like to use bread as an example. If you ever try to read the label on your average loaf of bread, even the whole grain kind, there's a lot of stuff in there that doesn't sound like anything that's actually food. And it's safe to eat, as far as we know, but what research is showing is that some of the things that are in our food affect the bacteria in our gut that are good for us. And polysorbate 80, which is I think that's a thickener, was recently called out as toxic to some of the good bacteria that live in our gut. Medications we take can also affect the environment inside of us. One of the medications that comes to mind rather quickly are the acid suppressant medications that a lot of people are on, and that's not necessarily a bad thing, but it will affect what bacteria live in your gut, because some bacteria like an acid environment, and when that environment is taken away by some of the medications we use, those bacteria can't survive there anymore. And that may be good or bad depending on the person and the situation. Infections can affect the bacteria that live in our gut, and infections can sometimes kill the things we want to live there and allow other things to grow that we don't want to live there. And then finally, the stages of our lives affect what bacteria live in our bodies. So I use this because my oldest son would not have it any other way to get his accurate picture in here. But from the time that he was a baby on the right to the time that he's 9.5 now, his his microbiome has evolved over time. And so when you look at kids versus young adults, middle-aged adults, and older adults, there's a difference in the bacteria that live there. And that's probably a good thing. It's important for those shifts to happen so that you can absorb the nutrients you need, the amount of nutrients you need over time. So when the microbiome goes bad, that was, if you remember that picture I first put up of that thick mucus layer, on the other side of that picture was what happens when the microbiome is not full of healthy little bacteria that we want it to be. And what happens then is we have a thinner layer of mucus, so less physical protection from toxins. We have less of the signaling into the body, into the immune system that tells the immune system sort of what's going on. We have more inflammation because of that. It triggers an inflammatory response when foreign toxins, byproducts, or bacteria get into our body. And we also have abnormal hunger cues. So those hormones that tell us that we're full, that bacteria tell us we're full, maybe don't work as well anymore. So who cares? What does that mean for us? So what happens when the microbiome goes bad, and this is just a very short list of what can happen, is we have the body's response to this excess inflammation. And we develop things like inflammatory bowel disease, diabetes, and heart disease are high on that list. Colitis, so inflammation of the colon, and then finally obesity. And again, this is a very short list, but all of those diseases, chronic diseases that we lump into that cardiovascular pool, high blood pressure, like I said, the diabetes, everything that puts you at risk for heart disease tends to come into this pool of diseases that are caused by inflammation, and we think are related to the inflammation that develops from changes in the microbiome. So I wanted to talk a little bit about some of the research that's out there looking at the microbiome directly and its effect on our bodies or experimental bodies. And I chose obesity because that's kind of where my focus is, but I also think that, again, obesity is sort of the big problem that leads to all the downstream effects like diabetes, acid reflux, arthritis, urinary problems, sexual dysfunction. The list goes on and on and on and on. So it's a very important disease to focus on. And so I'm going to take you through a little bit of the research, and then we'll kind of come back to some practical stuff. An interesting early study, I think this was done in 2006, was there were some rats that were developed in the laboratory. On the left, you'll see the obese mouse. And so that mouse was genetically modified to become very fat. And then the mouse on the right is the normal mouse. And what they did was they took the microbiome, that is the mouse poop, and they transplanted it into what they call germ-free mice. So those pictures represent mice that were born through a C-section, so they didn't get that inoculation from their mom, and so they have a really clean colon. And so they transplanted the poop specifically from the normal mice into one set of germ-free mice, and the same from the obese mouse into a second set of germ-free mice. And what they found was that the mice that were transplanted with the normal mouse's bacteria increased their body fat by about 27% over 2 weeks, which is pretty typical for a mouse. And those that were exposed to the microbiome of the obese mouse gained 47% of their body fat. So quite a big difference. And all that changed, they had the same food, nothing else changed in their environment except the fact that they were inoculated with the microbiome of other mice. in the bacteria in those mice, they found a big difference at the phylum level. So this chart on the right takes us back to our early science years in grade school or middle school or something like that. But we have the kingdom that includes the bacteria, and then we have the phylum. So the phylum is many different species of bacteria. And that's where they saw a big division. And so in the mice that have obesity, they saw a higher abundance of bacteria that are in the phylum Firmicutes. And I remember it, Firmicutes, F, fat. So the mice that had more fat had more Firmicutes. And the mice that were not obese had more in the Bacteroides phylum. And what they found was that those Firmicutes can actually pull more energy from the food that is eaten than the Bacteroides. So a lot of times you hear, maybe you don't, I don't know, a calorie is not a calorie. And when it comes to the bacteria in our gut, they decide what we absorb. And so the Firmicutes are going to actually pull more calories or harvest more calories from the food we eat than the normal bacteria, the Bacteroides that live in the guts of individuals who are of a normal weight. So the next question is the cause of obesity the shifts in the microbiome, or is obesity causing the shifts in the microbiome? So that's the next question that comes into the research. I think it's a chicken or egg question, but it is answerable. So the next thing the next study that I have here was they took some baseline mice, normal weight, born normally, and they looked at they looked at their microbiome and tried to break it down. What bacteria do these mice have? And they found that those Bacteroides were more common in their microbiome than the Firmicutes. So again, Firmicutes, fatter mice, Bacteroides were the normal mice. And then they put the mice on what would be a typical, we call Western diet. So that is high saturated fat, higher in protein, lower in fruits and vegetables, and lots of simple carbohydrates. And so they put the normal mice on this diet for about 3 months. And what they found when they looked at their microbiome is that they actually did have a rise in those Firmicutes, those bacteria that they think cause more fatness, and a decrease in the Bacteroides. So by eating a certain way or certain diet, those mice, the microbiome within those mice actually shifted. So that can happen in mice. So then the next question is, can it happen in people? Can we do this? Can we replicate this in the human? And we can. So a study was done where they took lean donors and transplanted the microbiome from lean donors to patients with metabolic syndrome, which is a syndrome of insulin dysfunction. So those individuals tend to have obesity, they tend to have abnormal cholesterol, they probably don't, their body doesn't respond to insulin blood sugar appropriately, and they usually have high blood pressure. That's the metabolic syndrome. So they took the fecal matter from the lean subjects, cleaned it out, kept those bacteria, and then inserted that into individuals who had metabolic syndrome. And what they found was that they actually had improved insulin function in those individuals. So they did see a change in not just the microbiome, but also the health outcomes of that transplant. Now, this was experimental. And we're not doing any fecal transplants at this point that are necessarily treatment or therapeutic in the medical community, with the exception of transplants for people who have Clostridium difficile colitis. which is an infection that happens in the gut. And so for those people that can't be treated with the usual antibiotics, they are using fecal transplant. So it's out there and it's being done, but I think just for one problem at this point. So being injected with someone else's feces doesn't sound very attractive. So the question is, can we do this by an easier and more enjoyable means? And I know you can't see this very well, so I'm going to explain the picture to you, and then I'm going to blow up the important parts. But this was a study where they took a bunch of people, and they put them in two different groups. And they put one group on a plant-based diet. So lots of vegetables, lots of fruits, legumes, which are beans and peas, and lots of nuts. But they weren't eating animal protein. And then they took the other group and they put them on a high protein diet. So lots of red meats, eggs, things of that nature. The top two boxes show the fiber intake for the two different groups. Plant diet is on the left, animal diet is on the right. And the green line that goes down the middle are the 4 days that the people were on these diets. So at the top box, as you can see, the individuals on the plant-based diet had a lot more fiber in their diet from their baseline and compared to the animal-based diet. And those on the animal-based diet had a significant decrease in their fiber intake and certainly was less than the plant-based diet. And then the next two boxes down similarly show the fat intake. So less fat intake in the plant-based diet, more fat intake in the animal-based diet. And then finally, the third row of boxes down shows the protein intake between the two groups. The last two rows, I wanted to pull forward so you could see a little bit more closely. What these show are the differences or the diversity of the bacteria in patients, as well as the changes that happened after they were on the diet. So the first row are the different bacteria that live within the body. So you can see on the animal-based side, there's a drop in that line, meaning that the bacteria we had more species of the same type of bacteria and less variety of species in the gut. Whereas on the plant-based diet, it went up a little bit maybe, but still had significant diversity of various species. On the next row down, it shows the changes in the bacteria that live in the gut and how that shifted. And so that means that they had all these different species, but did more of those species change to different things altogether. And in the animal diet, within 4 days, they saw a dramatic shift in what was living in the guts of those people that ate that diet. So their bacteria, they just started to grow different bacteria or more bacteria of certain kinds while they were on that diet in what seems to be a very short time. And that's what I think is the most interesting piece of the study, is that it doesn't take long to change what's growing there. Summarizing that research that we went through, so transplanting fecal matter in mice and humans can change the microbiome, and those changes can change disease states. We can alter our diets and also change the microbiome, so we don't have to do fecal transplants, we can do it on our own. And what we talked about was certain types of bacteria tend to be healthier than other bacteria when they're represented in our gut. Now I wanted to confuse you with this next one. If you're not already confused, let me throw this in there. So, when you think about this, you say, okay, so we know that the Bacteroides tend to be good for us. Why don't we just start taking a whole bunch of these certain bacteria and get everyone skinny, right? Wouldn't that be an easy fix? There are caveats to that, though, and I think this certain bacteria was a good example of that. Akkermansia muciniphila is a mouthful, and it's in the Bacteroides, in the Bacteroides phylum. And when they looked at individuals, or looked for this bacteria in individuals, the individuals who had obesity and who had type 2 diabetes, which are very closely linked, had lower amounts of this certain bacteria. And then when they looked at people who were treated for type 2 diabetes and were under good control, and specifically treated with a medication called metformin, and they looked at people who had a gastric bypass, one of the surgeries that help people lose weight, they found that there was an increase in that bacteria in the body. And so people got to a healthier state and they had more of this Akkermansia muciniphila. So now we're really at the point where we say, okay, make the pill, let's take the pill, let's lose the weight, let's fix the diabetes. The caveat is, in two other states, and two other disease states, in multiple sclerosis and Parkinson's disease, this bacteria is also overrepresented. So, yeah. And we don't know if that's a cause or an effect, but it shows we don't want to jump on this right away. And part of the confounding factors is not just that this bacteria lives there, but it lives next to other bacteria. How does that bacteria affect one bacteria? There are viruses that affect bacteria. There are chemicals that other bacteria release that affect this bacteria. And so there's a whole environment we're talking about as opposed to just one little species of bug. So, on to the more practical. What can we do to alter our microbiome safely? And the first, I think the first thing that comes to mind are probiotics. So this is one of the natural treatments that are out there. You see them all over the place. And I think after talking about that and talking about the Akkermansia muciniphila, you can see how just ingesting probiotics may not be ideal for everything. And there are downsides to taking probiotics. So what are probiotics first? Those are live microorganisms that are beneficial to our body. They are dietary supplements. I think there may be one prescription yeast species, but almost all of the probiotics that are out there are dietary supplements. And what you need to know about dietary supplements in general is that they are not approved by the FDA for treatment of any specific diseases. They have to be safe, so you have to be able to ingest them without hurting yourself, at least in the short term. But they don't have to be effective, and they don't have to contain what they say they contain. So there's no good quality control for these. And they can't make any health claims. So they can say, I'll change your gut this may change your gut bacteria, but it can't say it's going to treat your inflammatory bowel disease. On the flip side, drugs that you're prescribed by your physician or even that are over the counter have to go through an FDA approval process. They have to be safe, but they also have to go through studies to show that they're actually effective and do the things that the box says they actually do. And that's not just for probiotics, that's for any natural supplements that are out there. So if you wanted to take if you wanted to take probiotics, what would you take them for? And so there's some pretty good evidence of a few things that they have been shown to help, and then there's a lot of stuff that's still we're not really sure yet. But the things that have decent studies behind them, they can prevent diarrhea that's associated with antibiotics. They can prevent some severe disease in premature infants. They can treat infant colic. They can treat periodontal disease. And they also can be beneficial in ulcerative colitis, which is one of the inflammatory bowel diseases. Interestingly, the sister disease, Crohn's disease, it doesn't do anything for. It may be helpful for eczema, it may be helpful for colds. The studies don't show that for sure yet. A couple other maybes or inconclusive studies. Allergies, cavities and acne. And the two things that are not supported by evidence, that is, the evidence leans against using probiotics because they don't help, are asthma and urinary tract infections. And I think with anything, we always have to consider the do no harm perspective. And there's not a lot of study looking at the effects of the probiotics on our guts to look for the bad stuff, so the side effects of these medications. And we have to think about the harmful substances they might be producing or putting into an imbalance in our body by taking these supplements. Potentially they could cause infection. We're introducing live organisms into our body, and they could cause their own infection. And then the other thing that I think is interesting that we really have to think about is we're introducing a whole lot of genes in these live organisms that maybe have some mutations that cause resistance to certain medications, especially antibiotics. And once those genes get into our gut, they're going to be shared with the other bacteria that are there. And so that's really important, especially in the day and age where we have a lot of antibiotic resistance. They may not work, they may not do what they say they do, which is more of a side effect on your pocketbook than on your body. And finally, they may contain contaminants. And if you look at what's going on in the world of vaping right now, they think all this illness that's being caused is by contaminants. And likewise, with the nutritional supplements we use, there could potentially be contaminants in those as well. Other ways that we might be able to change our microbiome. Again, I talked about the fecal transplants, and that's only being used for C. diff colitis. But besides actually intervening, we can talk about non-intervention. I forgot, the other intervention is metformin seems to have a positive effect on the microbiome too. But non-intervention, so again, really thinking about if we're going to treat that gastritis or that acid reflux every single day with the same medications, are we having an effect on something downstream that might be hurting us? And that's just one example. And we don't even know what other medications might be doing to the bacteria that live there. Start out with a good colony. So like I said, if you're born normally through the birth canal, you're going to get your first inoculation with bacteria, and you want those to be good bacteria. So most of us in this room may be done having kids, but if you, me included, you saw them. But from a societal perspective, if we encourage healthy diets, we can then have healthy women inoculating babies who can also grow up healthy. And then finally, what I lump into the prebiotic category is our diet. And this is a way we can pretty safely change our microbiome. So probiotics are the bacteria that we put in, the live organisms that we use to try to shift the bacteria in our body. The prebiotics are actually substances that those bacteria that live there use. So it's food for the bacteria, basically. And if we ingest it, we're feeding our bacteria. So, what's your favorite food? What's your gut's favorite food? Those might be very different. But there have been some studies done that look at various diets and how they affect our microbiome, and looking at those healthier bacteria and which environment do they thrive in. And again, looking at that Western diet that's highly processed, rich in carbohydrates, low in fiber, low in plant matter, we start to see an abundance of bacteria that we don't necessarily want there. They start to increase inflammation and lead to diabetes and cardiovascular disease. The gluten-free diets on here, that's not been shown to, we don't know one way or the other with that. But the one that stands out, and you've probably heard of the Mediterranean diet, is the one that seems to increase a lot of good bacteria in our gut that leads to decreased inflammation in the body and less risk and or improvement of cardiovascular disease, diabetes, obesity, and overall inflammation, low-grade inflammation in the body. So what is it that our bacteria like in that diet? Why is it such an important diet for them? Well, it's high in fiber, and our bacteria love fiber. It has a lot of polyphenols, which are the substances in fruits and vegetables and herbs that give them flavor, that give them color. They're antioxidants, they're anti-inflammatory, and our bacteria really like those. Lower saturated fat seems to be better for the microbiome, and more fermented or cultured foods, which is actually a probiotic that we can ingest because those cultured foods contain live organisms. So things like yogurt and kefir, buttermilk, cheeses contain are cultured and contain live microorganisms. So what is the Mediterranean diet? And when I talk to my patients who were trying to work on their weight, I try to remind them that it's not spaghetti, it's not lasagna, it's not stuffed shells, it's not pizza. Those can be good. But really what the Mediterranean diet is a diet that is plant-based, focused on whole foods, that doesn't remove animal protein but minimizes animal protein. Okay, so there are lots of choices, and these 9 points or 10 points break it down pretty simply. You eat more vegetables on the Mediterranean diet. That's 2 to 3 cups of vegetables a day at least, and you can always have more. More fruits and more nuts in your diet. The nuts have healthy fats in them. Again, the fruits have fiber and the polyphenols that we talked about. More legumes or beans. So again, high in fiber, high in B vitamins. You get iron in the legumes. More whole grains. So that's things like brown rice. Other whole grains are quinoa, which is actually a seed, but we throw it in that category. Farro, which is one that I really love. Barley, oatmeal. Jim's giving me a funny look. What is farro? Farro is a really awesome grain that kind of looks like barley and has a really nutty flavor to it. Simple to cook. Cooks in 20 or 25 minutes. It's really tasty. So incorporating more of those whole grains into your diet. Now you'll see a lot of whole grain breads and pastas out there, and that's good for you too, but the further we get away from the processing, the more nutrition we're going to get from those grains. Eat more fish, but not too much fish. About 9 ounces in a week is probably a reasonable amount of fish to try to ingest and get all the good mono and polyunsaturated fats as well as omega-3 fatty acids that you'll find in fish. Use more olive oil, use less saturated fat. Butter is one of the saturated fats, but it seems like most of the places that eat mainly a Mediterranean diet and that are very healthy eat a lot more olive oil. If you're going to drink alcohol, drink it in moderation. So for women, 1 drink a day. For men, 2 drinks a day maximum. Less dairy in the diet. And when you do have dairy, it's more of those cultured products that I talked about before. Yogurts, cheeses, kefir, things like that. And eating less meat. So when we look at people who are really from the old world and eating the Mediterranean diet, the traditional Mediterranean diet, they don't eat a whole lot of meat. And that includes chicken, as well as all your red meats that you think about, pork and beef and lamb. And they eat less than 3 ounces of meat, of any meat, a day, on average. And they usually use it as more of a flavoring. So I think on this side of the pond, we tend to think of what are we going to have with our meat, Whereas over where there's the Mediterranean cultures, they look at their whole plate of vegetables and say, let me flavor this with a little bit of meat. What am I going to have with my vegetables today instead of what am I going to have with my meat? And then finally, herbs. It's a really important part of the diet because it really increases the flavor of everything you eat. And it contains all those good antioxidants in the form of polyphenols that are good for our gut. This is one of my favorite quotes that I think sums it up so nicely. It's from a book by Michael Pollan called In Defense of Food. And I had to put my part in there, but he does a pretty good job. So his statement is, eat food, mostly plants, and not too much. And the first line seems straightforward and simple, but as we talked about earlier, when you look at those ingredient labels, you see a lot of stuff on there that's not food. And so we eat a lot of stuff that's probably safe, may be safe for us, but may not actually be food. They're food products. So trying to get food in its most natural form, like whole grains, as I talked about, and then most of it being plants. So almost most of your diet just eating fruits and vegetables, nuts, legumes, grains. Yes?
Pollan calls everything in the center of the supermarket edible food-like substances.
There you go. That's right. They've been shown in the short term to be safe.
Could you repeat that with the microphone, please?
Sure. Michael Pollan says that everything in the middle of the supermarket is edible food-like substances. That sums up McDonald's too, if you ask me. And then finally, not too much. I don't think I have to explain that to you. Don't overeat. Other things that are really important in the Mediterranean diet besides what is eaten is how people choose to live their life, and it still has an effect on the microbiome and on their overall health. So community, faith, a sense of purpose, all those things decrease stress and tend to decrease the inflammatory hormones in the body. And there's also regular activity throughout the day. And not necessarily going to the gym every day for a certain amount of time, but being less sedentary, being active throughout the day and moving around a lot. And that exercise has also been shown to improve the bacteria that live in our gut. So I talked about the side effects of probiotics. So looking at the Mediterranean diet and all its prebiotics, could it have side effects? I suppose so. Large increases in fiber can be pretty uncomfortable for people and maybe for those around you. So start low, go slow. And dramatic changes in your activity level can cause some pain. So it's the same thing. Start low, start a few minutes at a time, increase gradually. So my conclusion here, the microbiome is fascinating to me anyway. There's a lot of studies still to be done to figure out how we can intervene and make ourselves healthier. But one of the things we can do is we can change our diets and change our lifestyle to improve the bugs that live in us.